This I just want to highlight because one of the allegations, right, has been put forward is, that David was allegedly engaging in illegal sex acts with a minor, right, with presumably Celeste. Um, and I know that there was at one point a question of was she pregnant or not? There's nothing to indicate this. Is there something about this particular section that stands out to you?
No, the report indicates the uterus was normal, so it wasn't enlarged as it would be in pregnancy. There wasn't anything seen on the inner lining of the uterus that would be seen in pregnancy. Uh, the external genitalia, the description is of decomposed tissue. So whether there was forceful penetration there, because of the advanced state of the decomposition, it wouldn't be seen.
I just want to go back to the skin defects. This is a part that we didn't talk about, or maybe we did. I just need to know if this provides any more information. Skin defect, excuse me, 3/4 inch. Entrance involving the right abdomen, 21 inches below the top of the head. 1 inch right of midline is a 3/4
Mhm.
inch length penetrating wound with smooth edges. The wound is orientated in the 3 o'clock and 9 o'clock directions.
Mhm.
Path. The wound track sequentially perforates the skin and soft tissue of the right abdomen and the liver. The wound track has an approximately depth of 1.5 inches front to back. The skin defect involving the lateral left lower chest, 15 inches below the top of the head.
Mhm.
6 inches left of midline is a 9/16 inch penetrating wound with smooth edges. Path. The wound track sequentially perforates the skin and soft tissue of the lateral left lower chest, left intercostal space, and enters the left chest cavity. The wound track has a depth of at least 2 inches left to right. The adjacent ribs show disruption of the cortical bone. Is this anything that we haven't
I
touched
mean,
on?
those are the serious fatal wounds that
Right.
are described by the medical examiner. As I said, going into the body cavity and hitting the liver, which would bleed extensively, and then hitting the pleural cavity on the left, causing air and blood to fill up that space. Again, seeing the blood and seeing the air is not possible this many days of decomposition, but the wounds are there and they mark the track of the penetrating weapon. The fact that there's injury on the ribs themselves might be analyzed for a specific weapon as well.